The dramatic surge in infections and hospitalizations were much higher than the first wave. Melomed hospitals have 6 facilities in the Western Cape and KwaZulu-Natal. Healthcare workers say they've had to face their fears every day coming to work. The promised vaccine brings hope. The focus is now shifting to educating people about the necessity of taking it.
We are going to be taking the vaccine first, all the healthcare workers, prior to anybody else. If we wouldn't be taking anything, that's not safe for us. So I just want to encourage that message that the vaccine is safe and it is effective if taken properly.
Only when 70 to 80% of the entire population is vaccinated, herd immunity could be achieved, possibly signaling the end of a period of fear and uncertainty.
In South African society, we have vulnerable populations. We have patients who are immune compromised, patients who have poor socioeconomic conditions, and those are the patients where if they contract the disease, they can actually succumb to the disease. So when we vaccine, we're not only taking a vaccine for ourselves and our families and our neighborhood, but it's for the benefit of the entire community. So it's incredibly important. In my opinion, it's the only way we defeat this great enemy.
Many people doubt that a vaccine that was developed so quickly is safe. But Dr. Abrahams says all necessary protocols and steps were followed. He says data on the vaccines is readily available and there has been great transparency. The reason for the speedy development is down to money and resources that was made available given the global devastation the pandemic caused.
In vaccine development, there's lots of steps that are redundant or unnecessary, part of the red tape or the protocols. So all of those things have been cut down in order for us to develop this vaccine as quickly as possible. And the reason for that is to save lives.
The doctors are urging every person to take responsibility for everyone else's lives by adhering to wearing masks, sanitizing and distancing to prevent a third wave of infections. An urgent plea has also been made for people with other health concerns to seek medical help immediately despite COVID-19, as hospitals and health facilities have good protocols in place to prevent the spread. Mariska Botha, SABC News, Cape Town.